for a diagnosis, they have to actually, for example, if they're going to diagnose you with cancer, they have to have evidence that you have cancer. They do
Yo,
an
Mosque Father, I just want to remind you, I'm actually in the medical field. In 1 year, I'm actually going to become a doctor. So I just tell you this in advance, by the way,
of
before
course.
you dig yourself a hole.
That's not, do they not need to do an MRI scan and make
Yeah,
sure?
now allow me to explain. Before they do X-ray, MRI, sputum, DEXA, all these fancy tests, they have to do something called a differential diagnosis. It's a fancy way of saying you need to do three best guesses. The number one guess is most likely. The number third guess is least likely. But you have to do three guesses. I can't like do a CT scan on you just randomly. I need to have a good reason to do it. Otherwise, I'm going to give you cancer. So I have to make best guesses first, and then I do the investigation to confirm the diagnosis. It's not the other way around.
So you're saying that they don't need evidence to make, or they don't need definitive evidence to diagnose someone with like something like cancer or
Let's
a.
use let's use Bubbles' example. If you come to me and you're coughing out green stuff, I'm not going to say, "Oh my goodness, he has cancer," because that would
I
be
know,
retarded. First,
but
I have to detect if you have cancer. You have to have unexpected weight loss, malaise, blood coming out of your mouth. You're spitting out substantial amounts of blood. Only then do I even consider cancer. If I said everyone has cancer, the oncologists, the cancer doctors, they would have an endless waiting list of patients. We have to be sensible here, brother.
correct. But like that's like obviously if you come up to a doctor with something as like trivial as I have a cold or my head hurts, right? They're just gonna probably write it off as like a standard cold or headache, right?
Correct.
But if they want to diagnose you with an EMG, right,
Hmm.
and determine whether or not like your muscles are like responding properly to the shocks, so
Hmm.
they definitely do need solid hard evidence for
It's from
some.
symptoms. The first you do symptoms. You don't go straight to the CT scan. That's retarded. You do a history and then you do investigation. You don't go to a person and say you have lung cancer. It doesn't work like that. You need to have a reason to even suggest that.
Yeah, that's fine, but we're talking about the actual diagnoses here,
Yeah,
right?
it's
And
a probability first.
well, hold on. Yeah, they're isolating certain things by saying, well, you probably have this, you probably have that. But for an actual like diagnosis for like a lot of these terminal illnesses, they do need evidence.
Correct, which is from the X-ray, from the CT, from the MRI, from the DEXA scan,
Yeah, that's we're
from
not
the
disagreeing.
mammogram, from
Yeah, we're
the sputum, from the microbiologist.
disagreeing.
You need to first. You need to do the guesses first. There's a saying in medicine: if you hear hoofs, don't look for zebras. Means if someone has symptoms, don't think of the rarest condition. Think about what's common, because common things are common. So we have to like. You need to understand probability is when science becomes practical. So
So,
probability matters.
well, hold on. I'm not. I never disagreed that
You
probability
did
matters.
because you said you disagree from the beginning.
No. So when you say right that the way that people form diagnoses or diagnoses, or however I say the word, is from probability. That's not entirely true. You know, there are certain diagnoses, a lot of them, which they need hard evidence for. Others, I'm not even sure. They can probably just like write it
All
off.
diagnoses needs an investigation. That's a fact. But I'm telling you, before that, you need to use probability.
But you, and here's the problem. So you are using. There's a few issues with this argument. So you're using the argument, or you're using the reasoning that hey, from this probabilistic standpoint, we can conclude that like God most likely exists, or
Mhm.
it's the most probable. Okay,
We use probability. Like, for example, if a patient says to me, "Oh, I think the government are using telescopes to read my brain," the first thing that goes in the psychiatrist's brain is that is so improbable. I have to section this person because he's thinking in very improbable ways. This is basic common sense. Even you will agree with that. So
okay. So
probability is the bedrock of medicine.
let's get out of the meta here, and let's stop talking
No,
about
no, we're
medicine.
not getting out here, brother. We're not getting out. I'm gonna take out my balls and
Brother,
teach you, bro. You're gonna be educated tonight, brother. You're gonna be educated. You're not leaving here without being educated, bro.
so let's understand. So, okay, you're saying that the argument, if I'm going to assume what your argument is here, it is so unlikely that humans, while albeit possible, very unlikely that humans could be created in a universe or in a world where everything is so specifically fine tuned for our existence. In
Yes,
ways
it
that we
is. Everything is fine tuned very heavily,
so
very heavily.
hold on. That's an assertion. But like the
How
thing
is
is,
it a session?
well, hold on. The thing that's in
Justify.
question,
Mhm.
fine tuning. Am I correct? Does that not imply that someone directly made it this way?
Well, I'll have to show you. I have to justify before I even begin to explain because there's so much. But I'll start with the eye and the cross section of an eye. 1 second.
Yeah.
Um, Copy image. First, I'll show you this, and then I'll show you the visual pathways.
Go ahead.
Visual pathway, and this is of a human being, by the way. 1 second. I'm only going to debate this, and then I'm going to leave because I need to prepare for my other debate. Now, look at the eye. Inside the eye, there's jelly. There's a lens. There's muscles that pull out the lens to calibrate the light, and there's a cornea, and there's also optic nerve. And the optic nerve goes all the way through the brain, the entirety of the brain to the back of the brain. Now, you tell me, how the heck can this happen with just an external pressure? I'll wait all day. Go on.
I don't know.
Natural selection and evolution.
No, I want early Moskva to answer this. I want him to
So the
explain.
question is, how can all of this be so complex? So you're arguing, how can this complex system exist that without like some intervention? So I'm going to ask you, with
With intervention. Go on.
yeah, so
With the natural nature.
Yeah, why is it complex?
Well, we have a nervous system, which is the optic nerve, and we know that's like a whole minefield of how complex it is. The nervous system, the nerves. Then we have the entirety of the brain, and that's a different part of the nervous system. Then we have the lens. It's being like pulled and shortened. That's a highly complex, intelligent way of designing it. I don't see how like the external pressure of wind is going to create such an intricate design of a lens that can stretch and close to calculate the.
You're begging the question. Why is it complex?
Besides Bubba, he's complex because he said the camera thing. But yeah.
Why is it complex? Because you're just saying.
I asked you to explain it, and you said I don't know.
Well, you're telling me, right? You're telling me these things exist, and you're just asserting they're complex. With respect
They
to
are complex.
Yeah, well, yeah, you're just asserting that. Now the question's being
I'm
begged
not
here,
asserting
right?
it. You can see. I even gave you diagrams.
So again, what is complexity?
Complexity is very difficult design.
Very difficult design. Now,
Yes, it's not straightforward. Opposite of straightforward, it's difficult.
Before I investigate this position, do you think I'll find any dictionary that at all defines complexity that way?
It depends on what dictionary you use.
Probably not. I'm willing to bet probably not. Right.
One sec. Let me call Snowy here.
Write down your definition again.
Hold the phone. Let me call my best friend. I'll be a minute. Let me get my best friend here. Okay, now continue.
Okay, write down your definition again.
Well, just tell me the conclusion, man. I don't want to do this stupid game. Complexity equals opposite of straightforward. I need to invite him again. Should we go to Snowy's VC, Bubba, or should we stay here?
Are you done?
Yeah, pretty much.